Welcome to Ultimate Skincare and Beauty Report. I'm Mary Winkenwerder. Personal enhancement procedures are welcomed by many across the world. They hold the promise of an enhanced physical body and heightened self-esteem. Joining us this episode is Dr. Marcelo Ghersi to share with us more about preparing a mental, emotional checklist before a plastic surgery procedure. Dr. Ghersi, welcome to Ultimate Skincare and Beauty Report.
Thank you. Glad to be here.
It's great to have you join us. So Dr. Ghersi, plastic surgery is a life-changing procedure. What happens to one's emotions after surgery?
Well, it's a great question, Mary, and obviously different people react to surgery in different ways. And several studies actually have been made to sort of follow the emotional response, the typical emotional response that a patient goes through after surgery. And it goes something like this. In the initial days after surgery, the first few days after surgery, patients are usually sore, they're swollen, they're in pain to some degree, and they go through this phase where they're sort of upset, maybe regretful that they had the surgery, and during this period we find that they're vulnerable. They are more emotionally sensitive. That's why it's very important. We stress that our patients have a good support system. They have a caregiver that can help them cope during those days with the pain and the general discomfort of having surgery. And that usually lasts for about a week or so, depending on the extent of the procedure the patient had. Afterwards, once the pain is gone, they start feeling more like themselves, and they start seeing the results of the surgery. Right. They're feeling better about themselves. It increases their self-esteem, and they go into a normal sort of a happier sort of phase. But you're right on. Those first few days can be very tense and difficult for people to cope with from an emotional standpoint.
So what are some of the ways a patient can prepare for their emotions pre-surgery?
Great. So first and foremost, we need patients to have realistic expectations about what they're going to have, right? And that's a little bit of the job of the plastic surgeon, right? Often we have patients that are doing plastic surgery for reasons that are not 100% in tune with what I guess what they should be, right? So that's the job of the plastic surgeon, to make sure that the patient has realistic expectations of what the surgery is going to achieve. And the plastic surgeon should also ask the patient what their goals are and why they're having plastic surgery. So that's sort of our job. Once we establish those goals and we make sure that they are healthy and they make sense and they're rational, we move forward with surgery. And the patient should prepare, to answer your question, the patient can prepare for that, again, using some of the techniques that I used before, finding a good support system, identifying one person to be the primary caregiver, so that that person can be there for them, especially during those first few days after surgery. She's going to be, patient's going to be uncomfortable, they're going to be in pain, and they're going to be more sensitive and vulnerable to external stimuli.
So, Dr. Ghersi, is it a good idea to get counseling before and after plastic surgery procedures to address these emotional issues that may come up?
You know, we don't typically recommend counseling per se.
Mm-hmm.
I personally, I am a big fan of counseling. I think it goes a long way, and it's not necessarily something that has to be used by people that have organic psychiatric diagnoses. As you well know, we live in a day and age where personal coaching, for example, is very much in vogue for successful people, for healthy people. And something like that, I think, is fantastic. I always encourage it, although I don't necessarily make it a requirement for my patients before surgery.
Fantastic. So, should a post-op patient keep a journal of what they are feeling physically and emotionally?
I think that's a great idea, and we encourage that because often they can read back on the previous day, and when they write things in a diary, it's sort of set in stone, and they can see how things are getting better and how they're improving, and that goes a long way in expediting the recovery process.
So, when is it a good time to share your feelings or concerns with your nursing staff or surgeon?
Always.
Okay.
Always, absolutely. We make it a point to make sure that we're always available to our patients, and most plastic surgeons, I would say, follow this sort of protocol. We see our patients. We usually talk to our patients the night after surgery, whether they're in the hospital or they're at home. We usually call them up just to make sure that they're doing okay. We see them the next day, and we always make ourselves available, because the most important thing, even a very important part of the recovery, even on par with the actual surgical result, is for the patient to know that they are part of a team, and their team is sort of behind them, and they're going to be taken care of during the postoperative period.
That's fantastic. That's wonderful advice. So, Dr. Ghersi, where can we connect with you and your medical practice online?
Well, we are on the main social media resources. We're on Facebook. We're on Google Plus. We have a website. We have a weekly blog that we're constantly adding content to. So we make it fairly easy for our patients to get a hold of us.
Fantastic. All right, Dr. Ghersi, thanks so much for joining us. It was great having you on the show.
Thank you so much for having me.
All right, catch up with me on my blog, www.beautybeautereport.com, and on Twitter @beautypublicist. Everyone, thanks so much for joining us on Ultimate Skincare and Beauty Report. Have a beautiful, successful week. Mwah.